So your partner just announced that she's pregnant. For 98% of you, this means you're going to be a dad. So congratulations. To the rest of you, that's a discussion for another time. Hi, I'm AI Dr. Beeman. My counterpart, the real Dr. Beeman, is a board-certified OB/GYN, father of 6, and looks way more official with a white coat. This is women's health for men and women. In this one, we're going to walk through what to expect at the first prenatal care appointment. Ideally, the initial visit occurs before 10 weeks gestation. At this first visit, expect a lot of questions about mom's medical history, previous pregnancies, and current health. You'll likely get an ultrasound too. This is ideally done between 7 and 13 weeks. It helps confirm the pregnancy is in the right place, helps determine the most accurate due date, and how many babies are in there. Yes, that's right. Sometimes there's more than one. In which case, double congratulations, but also, as a father of 6 spread out over 20 years, my deepest sympathy. We also order some standard lab tests on everyone, including a complete blood count, CBC, to check for anemia or other blood cell abnormalities. Blood type and Rh factor, because moms whose blood types are Rh negative, that's the positive or negative designation when someone says their blood type is, for instance, O positive or AB negative will need a shot of something called RhoGAM during pregnancy to prevent her body from developing antibodies that can attack the red blood cells of babies in a future pregnancy. An antibody screen to make sure the body doesn't have any sort of antibodies that can affect the current pregnancy. We check for rubella and chickenpox immunity. This ensures we know if the baby is protected against infections that are particularly harmful in pregnancy, and whether mom will need a vaccine postpartum. Also HIV, hepatitis, and syphilis testing, because early detection and treatment significantly reduces risks to baby. A urine culture is done to screen for the presence of bacteria that might increase the risk of preterm labor or kidney infections in mom. We also test everyone for chlamydia and gonorrhea because they are common and, if not treated, can cause serious issues. Additional tests are usually ordered depending on mom's particular history, risk factors, and preferences. For instance, cervical cancer screening or the various options available to screen baby for genetic or other conditions that can be detected prenatally. A pelvic or breast exam is not automatic, but could be recommended depending on mom's health history or symptoms. This appointment is typically way longer than subsequent visits. It averages around 45 minutes, so plan accordingly and feel free to bring questions. And pro tip, download Words with Friends or bring a book in case your OB is late. Babies don't come on schedule, so he or she might be running behind because of a delivery. But be patient, pun intended. It will be your bundle of joy, causing clinic delays sooner than you think. We'll also discuss nutrition, exercise, supplements, medications, and provide other health-related guidance. Bottom line, this visit sets the stage for a healthy pregnancy. And bonus, you'll probably get the earliest picture of your little one, who's going to be roughly the size of a gummy bear at this stage. This has been Women's Health for Men and Women, because the first step in supporting mom and becoming a dad is just showing up. And gentlemen, if you're wondering why you're gaining weight and craving pickles, check out my previous series on Kuvad syndrome or sympathy pregnancy. I think they're funny.